KNUST-TEK TV. Experience educational television.
Ladies and gentlemen, healthcare decisions should not be based on assumptions or convenience. They should be grounded in the best available evidence. Across the world, evidence synthesis has become an indispensable tool for informing clinical practice, shaping health policies, guiding investments, and improving population health outcomes. Despite remarkable progress in research across Africa, significant gaps still remain in our capacity to generate, synthesize, translate, and effectively use evidence within our health systems. This is therefore much more than a scientific meeting. It is an investment in people, partnerships, and the future of healthcare.
We live in an era where new health research is published every day. And yet, in the abundance of all this information, making the right healthcare decisions have never been more challenging. The problem is no longer the absence of evidence, rather it is knowing which evidence to trust. Health research is expanding at an extraordinary pace. Every year, millions of scientific papers are published. While this is encouraging, it creates a new challenge. Different studies report different findings, some conflicting with each other, some of high quality, others also of sometimes low quality. And busy clinicians and policymakers simply cannot read everything. Imagine trying to make a treatment decision after only reading one scientific article. Most of us wouldn't even trust that approach. Definitely, by reading a lot or synthesizing, we could get very stronger healthcare decisions and also utilize stronger evidence. This is where evidence synthesis becomes essential.
I'm a Research and Evidence Synthesis Fellow at the International Center for Evaluation and Development, and I'm based in the Ghana office.
Dr. Nana Akwesi Osumenta. I am a Research Associate at EAM Consult.
My name is Professor Muhammad Abdul Kabir.
Basically, what I do is centered around evidence synthesis. We do most systematic reviews and evidence and gap maps, as well as rapid reviews. Yeah, this particular one on evidence in health conference means a lot to us because, as I said, this is actually what we work around. You can see that there are lots of primary studies that are scattered, fragmented, across. And now the issue is bringing these primary studies into one portal, say the evidence and gap map, where researchers, policymakers can find where the evidence is and where the gaps are, and also doing systematic reviews to actually see where the findings are to inform policy. And so coming for this conference and what I talked about in giving my fraternal speech was that we as Africans should try come together and produce our own evidence, right? So we are not looking at evidence that has been imported from somewhere else, but then evidence that has been baked and done by Africans and used by Africans as well.
So before I joined EAM, I was part of the CBSE participants who were trained for the evidence synthesis program. This equipped me with knowledge and skills for conducting evidence synthesis. So using myself as an example, I know that this program is going to empower more students, more clinicians, and more interested persons in conducting evidence synthesis. So far it's been very good, though it's been challenging with the planning and everything, but then God being so good, we are seeing the success of the program. After this program, we hope that all participants who came from far and near would go with knowledge in conducting evidence synthesis. And also we are going to see a broad scope of application of what is being taught here and their various research and clinical practice.
This conference is to actually impact the knowledge of evidence synthesis to the participants so that with regard to health system researches, it will be based on evidence.
What I'm expecting participants to actually gain from this conference is the fact that we need to gather a lot of evidence which are conceptualized when it comes to Africa so that it informs the decision making in terms of health and health policy and health practice as well.